Hi, everyone. My name's Andrew Schachter. I'm the founder and CEO of Axiom Real-Time Metrics. I'm here with my colleague, Heather DiFrusicia. Heather, do you want to introduce yourself?
Hi, everyone. I'm Heather DiFrusicia. I'm the Associate Director of RTSM IWRS. Everything relating to randomization and inventory management is with me and my team. I'm excited to talk to you today.
Heather and I, primarily Heather, are going to spend a little bit of time talking about IRT done right in a 60-day period. How do you get it done, and how do you do all the things that are critically important, and how do you do it in a condensed time frame? So we're going to spend the next few minutes walking you through that process, and I'm going to be helping her through this, but really she's going to be leading this presentation.
Absolutely.
Heather, you crash your presentation.
As always.
So for a little bit of background, you've already met Heather and I. Axiom's been running studies for the past 19 years. The largest project we're currently running is 40,000 patients, which is a whole heck of a lot, and not our average clinical trial. Of course, many of the studies that we do are 10, 15, 20, 200, 300, 500, 1,000 patients, etc. Lots of experience in many therapeutic areas, and we've run a lot of studies. To that end, we started building Fusion 19 years ago. Fusion is an e-clinical platform that started life as EDC and has morphed in many, many moons ago into all the components you need to run a study, including data management, RTSM, CTMS, and ePro. We did our first randomized trial in 2003, and we've done a whole heck of a lot since then. Fusion serves as a connected hub for the entire study. So imagine a single sign-on to every piece of information that you're going to be interested in, instead of logging into 4 or 5 different systems and getting those pieces together from all the different data sources that you have. To that end, Fusion looks like this. It's a heck of a lot of modules where you can get to pick and choose the things that you need around your study requirements and build up the specific elements that are part of the study as a whole. So you really have the elements in front of you that you can choose. You're doing a simple phase 1, choose the elements that are relevant. Doing a more complicated study, add more modules to suit those needs. Today, of course, we're going to focus on IWRS.
Okay, so thank you, Andrew. We're going to talk to you about IRT. We're going to go through a little bit about today's time, how to select your IRT vendors, talk about our approach and how to get it done in 60 days, and touch on a little bit about some recent work. Before we get too into things, just wanted to highlight we love abbreviations when it comes to inventory and randomization. Basically, the 3 abbreviations that we have on screen are the same: interactive response technology, interactive web response system, randomization trial supply management, all the same thing. So let's talk about it in today's time. So when we're talking about the COVID-19 pandemic, there's impacts all throughout the different levels, everything from the manufacturer supplier level down to the subject level impacts. So specifically for randomization, there's impacts to screening, enrollment delays, and even changes to eligibility. When we're talking about inventory, then that's everything from procurement delays down to the impacts of subjects not being able to get to those in-clinic visits. So even looking to reach out to the depots for direct-to-patient support, as well as remote accountability monitoring via ePro. So how do you go about selecting the right IRT vendor? So really, we're looking for you to understand your own needs and make sure you're clearly communicating those via the request for proposal. So we're making sure that you're aligned internally. That's going to mean that you're going to get a more focused budget and, of course, minimal change orders after that. Really, what you're looking for is making sure you're finding a good fit for both sides. On the technology side, you want to understand, is the IRT vendor just strictly an IRT provider? Do they provide EDC and then they partner with a separate IRT? Or do they provide that full eClinical suite, IRT included? If they are that latter option, then do they provide standalone options or only the options for the EDC with modules? And of course, when you're looking at any technology, then we're looking also for flexibility to make sure that we can work through any challenges, especially on the COVID-19 front. So just talking a little bit more about the technology. So when we're talking about site inventory, it really is multifaceted. We're looking to make sure that does the IRT system accurately capture the inventory status? Is there flexibility when it comes to thresholds? Is it site or standard across the study? And how quickly can they make those updates? Additionally, looking at anticipated and upcoming needs, is there the ability to look at historical as well as planned activities to determine what a site's needs are? So continuing on selection, so support. What is their startup approach? Is it hands-on? Do they provide additional consulting? And then ongoing, post that go live, is there IRT expertise that's available on an ongoing basis? Is there a customer support desk? What's their hours and coverage? The last item is data access. So you have all this data, you want to make sure you can get that out. So are there standard reports? Is there the ability to customize? What's the availability? Are you able to log in and access those directly? Do you need to go through someone? And of course, the end of study outputs that are available for the sponsor and site level data. So what's our approach to IRT? So we provide both the team and technology, as you can see here. And this is including that guided support and ongoing monitoring of all activities throughout the study life cycle. And that's, of course, through my team. Andrew, do you want to talk a little bit more about the technology?
Sure. I'm actually going to talk a little bit about your previous slide. Can't emphasize enough to the process of how do you get IRT done right. It involves obviously a lot of important technology, but it also involves people who know what they're doing when it comes to IRT and can translate it into something that isn't a 250-page document on specifications. Because the needs around IRT are around drilling it down to the basics. Of course, it's fully integrated into Fusion, but as Heather mentioned, that team aspect is incredibly important.
Absolutely, and Andrew, just to add to what you noted, we really break down all of the details into manageable chunks, so then it's easy for our clients to digest.
Totally. In addition to that, jumping down, Heather, to the next slide, you have the ability, obviously, with Fusion to pick the modules that you need. So if it's just IRT, not a problem. Do you want IRT inclusive of inventory management? Also, the configuration can be set up exactly that way. You really get to pick what's of interest to you and what's going to help you move your study along and make it easier to run. Back to you, Heather.
Great, thanks. So on the IRT side, so we're able to support simple to complex randomization, of course, fully integrated, linked to your inventory, and all of those features are included, especially the ability to tailor to your protocol, your study needs, as well as your preferences. And of course, being able to visualize that through your custom dashboards and configurable reports. One of the highlights is the ability of modifying your control or layers of control when it comes to eligibility. So here you can see that there's different pieces that are coming together as part of that calculation to determine if a subject should be able to enroll, whether it's data entry requirements, inventory requirements, or other modules. On the inventory side, Fusion allows for that global inventory awareness, and that's everything, including, of course, inventory levels from the program level all the way down to the subject accountability, as well as pending activities, requests, shipments, making sure that those are completed on time, or those that need to are reminded.
Quick little note, Heather, on the previous point, we can integrate accountability down to the patient level, as Heather noted. And we could do that in a local diary format. So if the patient is at home and recording their accountability on a daily basis, or you want to remind them to take their drug, or ensure that they've turned on their medical device or gone through any processes, all of that can actually be done in a handheld app that's directly on their phone.
Great points, Andrew. Thank you. One of those items on the technology side for inventory is auto resupply. Those requests, as we talked about, that site inventory needs really is a combination of a multitude of factors. So Fusion's able to accurately capture that site inventory status, including items in transit, upcoming expiries, returns. For site thresholds, we have our resupply levels that are site specific and can be adjusted in real time. When we're looking at anticipated and upcoming needs, this is based on both historical as well as scheduled upcoming activity. So all of that comes together to determine a site's needs. Okay, so we talked about the technology, we talked about the support. How do we get that done in 60 days? So here are our kind of key buckets that we're going to talk through in detail. Starting at number 1, so determining your needs. We're going to start with those brainstorming sessions just to talk through high-level workflows to really understand your needs, any pain points. We're also going to initiate that base configuration right away to make sure that we have a head start on the study-specific configuration. From those original brainstorming sessions, we're going to take those workflows and really flesh them out so then we can walk through those together and, of course, ask way too many questions along the way. But really, we want to make sure that we're not assuming anything. You want to make sure that you understand all of those details. Of course, along the way, we need to make sure that we're communicating. So we determine that meeting frequency up front, and it's going to vary depending on how many open items you have from those brainstorming and initial working sessions, as well as what timeline you're working with. Is it a little bit more condensed than that 60 days? Then we may need to meet more frequently. For integrations and migrations, we want to define that communication flow right away and initiate contact early just to get things started. And then on the training side, we want to define those training methods. Or do we have an investigator meeting? Are we going to do a video? Are we going to do a mix of live sessions? And of course, scheduling those as early as possible, when possible, so then subjects and the site personnel can be ready to go at go live. During this process, we're going to be monitoring progress against the timeline. So reviewing those weekly and escalating any potential risk for delays. And when we're talking about those possible delays, we're mitigating those up front. So conducting live reviews wherever we can. And that includes the document side as well as UAT. As well, when we're talking about integrations and migrations, there can be vendor delays. And so always prepare a plan B. So starting with having a manual shipment option or process, having that nailed down just in case. Okay, so just switching gears, talking a little bit about the activities that we've done to support our clients during the COVID-19 pandemic, as well as some other recent projects. So on the RTSM support side, we were working with our clients to trigger shipments per region, and that was due to efficiencies needed when it comes to using ground transport instead of air. We were working with our clients to modify auto resupply. We needed to decrease it in some cases because of delays of inventory, of new inventory runs. In other cases, we needed to increase it so then we could support dispensing outside of the protocol schedule. So in advance of an upcoming or expected lockdown, we know that we needed to schedule all of these subjects for dispensing, and you need to have the inventory on site. The other aspect is remote dispensing, so tracking the dispensing for subjects that were not able to come in and be in clinic for those scheduled time points.
And Heather, I think it's important to know we had to do this across dozens of studies, practically, which obviously your team handled.
Yep.
It's a good highlight for people to be aware that whatever IRT vendor you pick should be able to react on the fly, because things are going to come up with critical things and you're going to have to change them. And they're not going to yeah.
And that's regardless of a pandemic. These kinds of things happen, and it's really important to be agile, to be able to respond quickly and come up with an innovative plan. So just touching on some of our recent projects. So on the Killian side, we worked with the client to centralize their study data, migrating from multiple systems to a single database, Axiom's Fusion eClinical Suite. And that included EDC, randomization, CTM tracking, ePro, as well as reporting. And that was for both their PNH and C3G programs. On the Tolmar side, we configured randomization and CTM tracking tools as part of their full suite. And this was for a multi-center trial, and released updates and provided lots of additional inventory support during the COVID-19 lockdowns they experienced. Also, we delivered tools required for EDC, ePro, randomization, and reporting for the global COP study. So that's just a hint of some of our recent work.
And a quick note on the COP study, it's one of the largest studies running in the world, supporting obviously activity around COVID-19. And we're really excited to be working with all of these organizations, and in particular, as it relates, of course, to COVID activities, helping Oxford along the way towards finding a solution to what we're all living with. So Heather, I just want to say thank you for all your time today and for a fantastic presentation, and to everyone participated and watched this session. Hopefully you found it interesting and knowledgeable towards understanding how you do IRT in 60 days. We're of course really happy to take your questions and help you through any questions you may have, and also help you understand just how do you make these things happen faster, better, and easier. Thanks, Heather.
Thank you as well.